I've been treating probably 60 to 70% of our patients here would be from low back pain. So I've had a fair experience in terms of treating people with low back pain. And I think out of this, I wanted to come and educate people. How can I give you the tools of what we do as physios? What are the steps we take to, what's our thinking processes behind what we're doing when we're doing it, so that you can start to do some of this for yourself. Because ultimately, as I said to all of my patients, we work as a team. You know, the better we work as a team, the better results you get, and then we're all happy. Today is a bit about low back pain and sciatica, and I'm going to step you through a couple of things. First and foremost, what it is. I want to ask you a question, why it hasn't got better, and then I want to step you through things such as the phases of healing, and then a system, and I employ a system of treatment, which for me is self-evident. It's not rocket science, it's self-evident of how you can fix yourself. All right? So that's what this is. So I've already got up on the board. So just to clarify, sciatica, do people understand what sciatica is? Yeah?
I know I've got it, but can you sort of give us a medical review?
Well, sciatic nerve, think about the sciatic nerve. It's pain that runs down the distribution of the sciatic nerve. All right? Now the sciatic nerve starts in the lower parts of your back, all right, from 5 levels, runs through your bottom. What's really fascinating, I brought this with me today, so you can all see. It runs through this notch here. Can you see that notch there? That's called the sciatic notch. Runs through a couple of muscles, all right, and above some muscles, which if in spasm cause pain down the leg. So there's another syndrome that can also cause pain down the leg, which is slightly different. All the way down the back of the leg, often down the side of the leg, and often affecting more the outside of the foot, but certainly any part of the foot, okay? So, can anyone tell me how to know if you've got irritation of that nerve versus compression of that nerve? Because a lot of people say they've got, yes?
Is the heat the irritation?
Possibly the quality of pain, certainly the quality of the discomfort, so lansating or toothache pain. Often I think people who have got this sort of this calf pain, that's a real classic for me. Pins and needles around the foot, that's a classic. That's irritation of the nerve. But if you have put pressure on the nerve, you actually have 3 different symptoms. Does anyone know what they are? Well, it's lack of power, lack of ability to use a muscle. Often you might see, I've heard of people who have perhaps had a complication from surgery and had foot drop, which is not a good complication to have. The other thing is lack of sensation or paresthesia, so loss of sensation, numbness or numb-like feelings or pins and needles. And the third would be loss of reflexes.